Now we go to Michelle Carrillo. Michelle, that red is coming through beautifully, much like Eva in the foreground in the last image. And Michelle is from Del Norte and adjacent tribal lands. Take it away.
Thank you. Ndelaha. I live and work in a place known by the Patalawa people as Meishondon, the place of plenty. But in the past 150 years, there has been great loss, genocide, and a boom and bust economy. It is also a place where people help each other in times of disaster like right now, and where my predecessors had the forethought to collectively save, not for themselves, but for the future generations to come, reaching across arbitrary county lines and state lines to build a community foundation in service to a thriving, just, healthy, and equitable region. My journey with this place, a small, predominantly white, rural, and conservative community where the redwoods meet the sea, has been one of change, growth, and perseverance towards that greater purpose. In 2009, Del Norte County ranked 55 out of 58 counties for the poorest health outcomes in the state of California, according to Robert Wood Johnson. At the age of 22, when rural communities were still feeling the ripple effect of the recession, I came home for a job, but coming home meant failure. It meant you weren't good enough to make it out there. For me, it was a path to meaningful career and a livelihood that even as I navigated being a single working mother, I found deep connections, people that believed in me and invested in my development as a leader in systems change and health equity. 2009 was the year our community embarked on a 10-plus year journey to build a healthy community. At the beginning of this decade-long work, it seemed impossible that Del Norte could be a place where people worked across party lines, systems, governments, and nations to address health equity. The vision that every child should be able to dream, and those dreams are our community's responsibility, sounded radical and unattainable. But those that came before me carried on. We put people at the center of our work, setting universal goals around literacy, food access, and other critical intervention points. And we sought to understand the systems of oppression and barriers faced by many through an empathetic lens, and then created space to reimagine our futures and co-design solutions to get there. Today, Del Norte is ranked 45 out of the 58 counties. And we have changed the odds because we changed the way we thought about ourselves, our neighbors, our community, and our future.
Thank you, Michelle. Just the notion of acknowledging those who came before us, the notion of creating spaces, the notion of conversations, and how nice that you would weave in your personal narrative.